another opportunity on Wellness Wednesday. And my name is Libra Forde. I'm the Chief Operating Officer here at Self Enhancement. And on Wednesdays, we like to gather folks from our community and talk to them about how they're dealing with this time right now. And if you don't know already, Self Enhancement is a multi-service agency. We focus on African American youth and families. We service just over 16,000 youth and families every year, and we focus on making sure they know that life has options. But today, I have Miss Dana, and she has been a nurse for over 30 years. Her and her husband are actually ambassadors here at SEI. They are truly supportive. Our ambassador program is helping us build out some new entities at SEI, including our African American Cultural Center. And they are committed to our families, supporting our families, and also supporting the community. And she, as a nurse, obviously is also supporting everything right now because there's so much going on. She's at Providence, and we're super excited and grateful that she's taken out some time in her day to talk to us. So, Miss Dana, how are you and your family doing during this time?
Well, we are just trying to stay safe and stay home, um, and checking in on our other family that's out of town. So,
Yeah, yeah,
specifically my parents who live in Atlanta, just trying to keep them safe. They're in their 80s, and so just
yeah.
trying to keep everybody safe.
Yeah, absolutely. And we need to make sure that we keep you in the light because you as a nurse in 30 years, have you ever seen anything like this?
No, Libra, I've never seen anything like this.
Oh God.
And we've seen, quite a few things, but nothing like this where, that I mean, we're in a pandemic
Yeah.
and there's no vaccine and there's no antibody testing that's in place
Hmm.
right now. But there are some things that are finally starting to work. Um, that the doctors are finally starting to work on. So
Hmm.
I know Providence is starting antibody testing with
Mm.
just employees, people that have been
Oh.
exposed to patients that have COVID or and even those that don't have symptoms. So
Mhm.
I did see something come out about that they're starting to do that across the different Providence hospitals. So, and that's
Mm.
to help, hopefully in the long run, come up with the vaccine, the information that they gather. Because
Mhm.
you have to remember, this is all new,
Yeah.
and they still are just learning things about this virus.
Mm.
Um, and even as today, I heard on CBS News, Gail King did a special with a doctor um, from back east who volunteered at a hospital in New York and worked
Mhm.
in the ER with a lot of patients and discovered that maybe we don't need to use the ventilators. Maybe there's
Mm.
other treatments we can use.
Mm.
But he discovered that patients were coming in, and when they were coming in to the ER, they were quite sick, but their oxygen levels were extremely low,
Mm.
which sparked him to ask the question, well, why is that? Why is when they're not they're coming in with shortness of breath and their oxygen levels are just extremely low, like
Right.
50 is considered low.
Right.
And so that's when they discovered that this disease that's attacking the lungs is really progressing slowly.
Mm.
So
Mm. Mm.
maybe if people are testing their oxygen levels sooner, they
Mm.
can detect if it's gonna go towards, getting pneumonia. So
Right.
that's something that just came up today, and I was like, "Wow,
Yeah.
that's good. That's
That's
good.
good
That
information.
we can keep people off ventilators and try other treatments to
Mhm.
help, give them oxygen and improve their lung capacity,
Mhm. Mhm.
which would, improve them getting through this." So.
Yeah. So, I mean, that's interesting that you're talking about the lung capacity because one of the underlining conditions that people are saying you are concerned is asthma, right? And so, as a person that has asthma myself, it's always interesting when you hear that, right? Because the second
Mm-hmm.
that people say thing that you're connected to, all of a sudden you're just like, my ears are open. What are you talking
Right.
about?
Right.
But what does that mean? Like underlying conditions, like what does it mean that you are more at risk with underlying conditions?
Well, the CDC is saying that those with diabetes, those with asthma, if you're over 65 and over, because most elderly that are 65 and over have a lot of other conditions,
Mm-hmm.
and for some reason, this virus attacks the lungs, and
Mm-hmm.
so a person sneezes or coughs, and if you're less than 6 feet away from them, it's going to linger in the air. You can come by and breathe it
Mm-hmm.
in, and it can go right to your lungs. But the
Wow.
thing is, it affects everyone differently.
Right.
So, but if you have an underlying condition like asthma, diabetes, pneumonia, I mean, not pneumonia, excuse me, asthma, diabetes, um, uh, any other medical condition that, you know, it would affect you more.
Mm-hmm.
Different, harder. It would be
Mm-hmm.
harder for your body to fight it.
Right. Right.
Um, so I hope
Hmm.
I answered your
Yeah,
question.
you absolutely answered the question. And I think the other thing that's interesting is as you talk about this, and clearly as a nurse, there's a reason why you are a nurse for 30 years, right? It's a passion for you. And so I want to try to connect to some of our youth who are thinking through, and maybe before this, they had a huge passion for the medical field. And this sometimes for youth can be a reason why they change their mind. And so, what would be a reason for you to give them to not change their mind and to kind of stick with it if that's really the direction they want to go?
Well, first of all, I would say they'd have to have a passion for it,
Hmm.
and you have to have compassion for people. I mean, you have to
Yeah.
love to help people,
Mm-hmm.
um, and you just know. I mean, for me, and I'm just going to use my experience as an example. I thought I was going to be a lawyer, so that was my goal, to be a lawyer. But my uncle was a physician, and I don't know, he saw something in me, and he said, "Dana, you really ought to think about going into nursing. I just think you would just make the greatest nurse." And at the time, I was working with kids, babysitting or whatever. And
Hmm.
so he said, "If you're interested, I'm on the board at Dillard University. I can see, about getting you in. Just look at it." And
Right.
so I did. And I went to nursing school, and the rest is history.
Right. Right. And that's the key, though, right? Sometimes it takes that one adult, and we call it a
Yes.
caring adult in
Yeah.
our world at SEI. All of our coordinators, we consider caring adults to see something in you that maybe you don't see in yourself, and then you just push forward and really work through it. And so, just like I'm thinking that some kids that maybe didn't have the passion, they may change their mind at this point. But I do think some kids, like even my own, they wake up and they think, you know what, I would want to be a part of the solution for this.
Right.
And how
Right.
do I
Right.
find that? But that takes passion.
Right.
Takes passion. Absolutely. So, and as a nurse, I know you see difficult things, and every single day when you see those difficult things, what keeps you in your passion and saying, I'm in the right place and I'm never gonna give up on this?
Oh, wow. I feel I've been blessed to work at the Child Center. I've been there
Mm.
for about 19 years now.
Wow.
And so we have an opportunity to really help families who have to make difficult decisions
Mm.
with their kids that are medically fragile.
Mm.
And so they entrust us with their kids. And
Mm.
so to be a part of that, I don't know. To me, not everybody can do it, because when I tell
Yeah.
people what I do, they say, "What? You do that? How can you do that? It's so sad." And you know,
Oh,
but
yeah.
you get to know the kids, and every child
Mhm.
is different, and you see the light in them.
Right.
And
Yeah.
so for me, that's what keeps me going.
Yeah.
And my coworkers. I mean, I work with some great people.
That's cool. That's super cool. I think the other side that's really cool, Miss Dana, is that you look like so many of our kids, and a lot of times when I go to the hospital, or when many of us have been in the hospital, we don't see a lot of people that look like us. And so it's just so important that you are there. And if no one has said it to you, I am so happy that you're there, because I know if I had to be in a position where my children were in the center that you were at, I would
Mhm.
love to turn around and see a face like yours. So I
Yeah,
appreciate the
yeah.
energy and
Thank
time
you.
you're putting into that. That's really important.
Thank you.
So just to kind of wrap things up, I think we got a lot of information out there about what we need to be wearing or not wearing. Well, the information changes every day,
It
but
does.
what do you
This
recommend
week.
that we wear?
Oh, wow. Well, you need to stay 6 feet apart, period. And that is the length of a bed, to make
Yeah.
it plain for people. I'm a visual person, so
Yep.
yeah, 6 feet apart, length of a bed. And the grocery stores and different stores, if you have to go out, they do have markings on the floor, which
Hmm.
is great.
Yeah.
Um, and then, you need to wear some type of protective covering.
Yeah.
If you and that's just so because you don't know if you haven't been tested, you don't know if you're a carrier, and
Hmm.
think about, you may not be carrying it, you may be carrying it, and so
Hmm.
you don't know, and you don't want to um pass it, because even with talking to someone, if you're less than 6 feet, those droplets can go to that
Hmm.
person that you're talking to.
Hmm.
So, and I think, nursing homes and people that are over 65 are really, really getting hit hard with
Yeah.
this, if you
Hmm.
watch the news.
Yeah.
So that, and hand washing your hands, 20 seconds, soap and water, that's what you do. You sing the birthday
Hmm.
song twice while you're
Sing it
washing your
twice.
hands.
Yeah. Yeah. I
Soap
definitely
and
been doing
water,
that.
and it doesn't matter if it's warm or cold water, you just
Just do it.
wash. And if
Right.
you don't have soap and water, use hand sanitizer.
Yeah. Cool.
That's at least 60 or 70% alcohol.
Okay, cool.
Yeah.
Yeah, we definitely been doing those things in my household, but I've also bought more lotion, because I'll tell you, I
Mm-hmm.
clearly was not doing this before. My hands have never been so dry, but I'm so committed to the dryness, because I feel like the more dry, I'm doing my job, and that's what I need to do. And so I just put some lotion on and I'm good to go.
Yeah, and then wiping down, the surfaces in your home,
Mm,
and they say that soap and water is the best for killing coronavirus, according
really?
to the CDC. Yes,
Okay.
soap and water.
Okay.
That's number one. So, I mean, wiping down your countertops, your doorknobs, your light
Huh.
switches, things like that. Also, bleach is good,
Hmm. Yep.
and rubbing
Okay.
alcohol if it's if it's between 60 to 70% alcohol.
Alcohol, yeah.
Yeah.
Well, I mean, going back to my grandmom and all that, I mean, those are things that she's always used. So I think it's just as I know, for me and my family, bleach was, you always knew when it was the weekend, because the whole house
Oh,
just
I
smelled
smell like
like
bleach.
bleach. Yeah. There was no area that you were free from bleach smelling. So we definitely
Wow.
probably need to go back to some old school traditions and make sure we keep up with them. So all in all, Miss Zane, is there anything that you feel like our community needs to hear from you, and just from your heart to everyone else's? What would you like them to know?
Whew, just hang in there. Just
Yeah.
hang in there. I know it's rough. People are losing jobs and
Yeah.
uncertainty. Kids are home,
Mhm.
schools are out. It's a lot. It's a lot
Mhm.
for people to take in, and just remember to stay safe, stay home. If the news, there's a lot of negativity, but there's,
Mm.
things we have to know. But sometimes it's okay to unplug from
Yes.
the news.
Yes. I
Sometimes it's
so agree.
okay.
It is
Yeah,
okay.
yeah. And just, make the most of this time if you can by getting out, walking,
Mhm.
again, wearing your protective mask, staying 6 feet apart, getting out in nature, talking to your kids, because, it's hard. It's hard
It
on
is
them.
hard. It is hard.
Um, And just being together, with your
Mhm.
family members. I know my daughter has started coming over. We've been having Sunday game nights, and that's
Yeah,
huge because
that
I'm the game
is
player, and nobody wants to play games, but now they do, so I'm happy.
and that's what I find right now is the family opportunity has been amazing. And some of the things that just always seemed like I didn't have the time or space for, there's no excuse, and just
Yeah,
diving in and having the space for it now. That's been the real gift I think that we've all received. So I just want to say thank you, Miss Dana Rashad. We couldn't have done this without you. And you got to know that we are definitely thinking of you and putting you in our prayers as you stand in the front line with the rest of the frontliners.
thank you.
Um, and in particular, you look different than many of the people that you're standing next to, and we just
Mhm.
appreciate you for being that trailblazer in this world right now. And one day this will be history, and one day
Yes.
we will be past this, and super excited that you'll be one of the heroes. So thank you.